Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's episode is Preconception Cleansing for Women and Men with my friend, Dr. Jeff Morrison. Dr. Jeffrey Morrison is an award-winning medical doctor, leader in the field of integrative medicine, and champion of nutritional approach to healthcare. His focus is on preventing and reversing degenerative and chronic diseases by enhancing the body's innate ability to heal and detoxify itself. In 2002, Dr. Morrison opened the Morrison Center in NYC, where he has used his successful integrative medicine and nutritional approach for patients with many types of medical conditions. Dr. Morrison has an undergraduate degree from the University of Rochester and received his medical doctorate from Jefferson Medical College in Philadelphia. He is board certified in integrative medicine and trained in family practice and environmental medicine. The focus of his practice is integrative, functional, and environmental medicine. Dr. Morrison is also the author of Cleanse Your Body, Clear Your Mind, and has made many television appearances, including The View, written journal articles, chapters for textbooks, and has lectured throughout the country in the field of integrative and environmental medicine. Visit morrisonhealth.com to follow him on Twitter, become a fan on Facebook, and watch his videos on YouTube. Welcome, Dr. Jeff Morrison, to the show. I'm so excited to have you on today.
Thank you, Dr. Laura. I'm very excited to be here today as well. It's always fun to have a chit chat with you.
Yes. So we go back several years. I first met you at a functional forum in New York many, many years ago. And I've always been so impressed with your practice and how you incorporate environmental medicine into a functional medicine practice, and really how that does impact people's health at so many levels, our environment, and can really be a major contributor to chronic illness. So I think it's just brilliant.
Well, thank you. It's a topic that's been near and dear to my heart for as long as I can remember. I was fortunate when I graduated from my family practice residency in Harrisburg, Pennsylvania, that I was able to work immediately with a doctor that did environmental medicine in Mechanicsburg, Pennsylvania, which is in central Pennsylvania, if you've never heard about it. And I'm just throwing a shout out to my peeps out there. But it was wonderful because we took care of patients with heavy metal toxicity, chemical sensitivities, and then food allergies and conditions that were not getting better from conventional treatments. And I had a lot of really great mentors at that time, including chiropractors that just taught me the importance of not only alignment, but also like the whole, really, this was before functional medicine was even established. I'm dating myself, but chiropractors kind of had it ever since the beginning.
Mm-hmm. Yeah, that's true. And, our training as chiropractors is that alignment is impacted by physical, chemical, and emotional stress. And typically we have a little bit of all three of those stressors in our life. But I think for today's episode, we're really going to be focusing on the chemical stress component. And we know that chemical stresses include junk food, toxic types of foods. It includes medications, prescription, as well as over the counter. It includes caffeine, alcohol. But then there's a whole nother avenue that I think a lot of people don't think about, which is the toxins in our air, our water, plastics, our skincare products. These are things that are just in abundance with all these types of chemicals out there. And our bodies are getting just bombarded with this really heavy load on a regular basis. So it's something that I really want to bring to the attention to the women and men that are listening to this podcast that are looking at conscious conception and really want to prepare their bodies to create the healthiest pregnancy and baby possible. And there's a lot that we can be proactive with prior to getting pregnant from a detox perspective. So I'm excited to talk about that today.
And it's a great topic because it's important both for men and women and babies. It's really the things that we're doing before we conceive or conception occurs, while a woman is pregnant, and then afterwards is important both on the physical level, and I will make a case for the emotional level as well, because specifically when it comes to detoxification, when a man or woman is stressed, that has a very significant impact on how well the body is able to detoxify itself from the things that we're getting exposed to on a regular basis, which may be normal or maybe some of the more toxic things that we'll be talking about. So stress is important, and the goal is to try to help manage that either through meditation or exercise or routines, which I'm sure you've been talking about so often in the
Mhm.
past.
Yeah, definitely. Meditation is a big one that comes up with a lot of my guests, and really just especially for women that are wanting to get pregnant and are, let's say, in high stress jobs, and or maybe are have a child and are looking for a second or third pregnancy and have the stress of being a working mom. It will impact fertility for sure. And I really do appreciate that you're talking about how emotional stress impacts our body's ability to detox. So let's talk a little bit about that. Like, first of all, can you just start with what are detox pathways? How do we detox? Do people detox differently? So let's go there.
Well, let's, and also I will also say it's good to start not only how the body detoxes, but also we're going to talk about people. We're going to start out talking about the people that are thinking about becoming pregnant and want to get their bodies into the healthiest shape that they possibly can, so that they can have a much easier time with conception. And men don't often think of themselves as being part of this process, but like I would think of this as you got to make sure that the seed is healthy and that the soil is healthy. And if they're both healthy together, then it's much more likely that a baby is going to, a stork is going to bring a baby. Uh,
Right. And a
is that
healthy
scientific?
baby, right? Like this is the ultimate goal here is a healthy baby. And that is directly impacted by the genetics of mom and dad, 50% each way.
Yeah, absolutely. So when it comes to detoxification, mostly we're talking about a physiologic process that is a phase one, phase two, and phase three process, and it basically is the body's way of managing chemicals that we're getting exposed to on a day-to-day basis, and those chemicals could be uh, byproducts of our own cellular metabolism, like just normal toxins that are made just from our own cellular waste, but also from the foods that we're eating, like heavy metals that come from tuna fish or big fish, or plastics that are now being found ubiquitously from the water that we're drinking, or from persistent organic pollutants from fish that are farm raised, and also from like skincare products, which have like now everybody knows about parabens and phthalates. And when we apply it to our skin, it gets absorbed and it has an impact as endocrine disruptors, which means that it interferes with proper hormone functioning on both men and women. So it makes men less fertile and it makes women less fertile also. And so our body is constantly getting bombarded by thousands of different chemicals, toxins, fertilizer, like pesticides, and it has to constantly manage these both on a cellular level and ultimately in the liver, which then packages them up, transforms them into packages that are able to be passed out of the body, and then through the digestive tract, which is the phase three of the detoxification process, and why it's always important to have a healthy, quote unquote, exhaust system. So regular bowel movements are essential to make sure that the detoxification process is complete.
Hmm.
So,
Yeah, we don't want to move the garbage around the building and have it not exit the building, right? That is a big issue. Sometimes when I see people will do a detox that isn't supporting that phase three, and they'll actually feel worse because they're pulling toxins out of their organs and cells and tissues and just relocating them.
oh yeah, yeah, it's just like dusting and like on the top of a refrigerator, and then it all gets like spread out, and then you start. It's just a mess. Gotta do it the right way. So number one is making sure that we're recognizing that we are getting exposed to toxins, and then when a person has stress, it slows down that detoxification process since the stresses are often how we're experiencing stress. Like, of course, there are good stresses and then there's bad stresses too. And if a person feels like there's bad stresses which are causing anxiety or irritability or sleeplessness, those are stresses that are actually shutting down the detoxification process. And it really comes down to the body gets into this fight or flight response rather than the rest and digest part of how the nervous system is supposed to work. And that's where the detoxification happens. So that's where doing rituals like morning exercise or morning meditation, and then making sure that a person is checking on their healthy relationships, both with their significant others and the people that are around them, family, coworkers. And then also, if this is not getting better, a person really should be working with either a counselor or their holistic health provider so that they can get a workup and make sure that there's no nutritional deficiencies or nutrient imbalances or amino acid imbalances or neurotransmitter imbalances that could be affecting brain chemistry, which is precipitating these fight or flight responses. And that's really where Laura, probably you are doing a lot of blood work, just like I am, to show some patients that there may have B vitamin deficiencies, or low vitamin D, or amino acid imbalances, or fatty acid imbalances. And sometimes once we find out where that problem is, just by either replenishing something simply can make such a huge difference in both their nervous system, their detoxification process, and of course, ultimately how a person's feeling, with the goal of improving their success in fertility and having a healthy pregnancy.
Right. And I do find that, like with neurotransmitters, vitamin D, things like that, that are produced in the gut, if their levels are off, then we have to do some gut healing, right? Which is quite common with people with chronic illness. So, in addition to supplementations, a lot of times it's also there's a leaky gut, that needs to be fixed.
And recently, we've been seeing, and maybe I'm sure you're seeing this in your practice as well. So many of those patients with the gas and bloating and constipation and loose bowel movements, or chronic rashes and chronic allergy symptoms. Nowadays, we're seeing so many patients that have like not only bad bacteria, but even parasites that they got from eating raw fish at the sushi bar or from traveling abroad. And again, it's a total load effect, and that's where the environmental medicine component comes in. So if we can identify and remove the different loads, like the toxins or the parasites or heavy metals and preservatives and plastics and all that stuff, the body just will have a much better ability to work properly to accomplish the goals that we want to.
Yeah. And I think that's what I love about your practice is you're very keen on identifying root cause. And there could be more than one, right? That's creating a health challenge, but it is about the identification and then addressing that issue, as opposed to masking the symptoms.
How about that one patient that we were working on together, for the woman that had those strange allergy symptoms that and her husband was not having any issues at all, but it was discovered that they had a terrible mold problem in their home,
Hmm.
and she became super allergic to foods.
Yes.
And
And
through
very
your
sick.
terribly,
Yeah.
terribly, it was almost a disaster. And just by the good fortune that they finally moved out of their home uh, to their parents' place, that she started feeling better, and her husband even started feeling a lot better as well, because they were no longer getting exposed to the toxic molds, which are toxins that will cause inflammation and interfere with proper body functioning.
And I think that's an interesting case too, where this is two people having very similar exposure, right? They both lived in this toxic mold house. They're newlyweds. And this is their first home together. It's like it's a very sad story. But the good news is now they know why she was so sick. And you speak in your book, Cleanse Your Body, Clear Your Mind, how people that are thin, which this woman is very thin, that have less fat stores are more sensitive to these toxic exposures because they don't have anywhere to store the toxins, right? I mean, this is a good example of that.
Yeah, it is true that if a person's detoxification pathway through like urine and stool gets overwhelmed, the next place that toxins will end up going is into tissue. So in people that have fat, actually, this is one of the situations where people that have fat will have a little bit more cushion, so to speak, for having exposures to toxins. Now, by the way, that it's a double-edged sword because when the fat starts accumulating toxins, it's also more difficult to burn off. So we also see a lot of people that have had weight gain from, maybe not following a specific meal plan during their younger years, and then at a certain age they want to try to lose weight, and they find it's very difficult. And we often find that when they do start losing weight, they feel like toxic from the toxins that are being uh, returned to the circulation, and then they're getting a secondary exposure from something that's been stored there for many, many years. So it's better to try to keep ahead of it by eating a healthful diet, which we've talked about in our book, and it's all over our website. And Laura, I'm sure you've got people on like the anti-inflammatory meal plans, and then working on the mindset, and then making sure there's no nutritional deficiencies, and making sure that there's no exposures. And by getting all of those things into alignment, then a person's going to start turning the corner and feeling a lot better, losing the weight, having better fertility success, things like that.
Yeah, it's really about the body being able to heal itself. The innate intelligence in the body always supports healing. And when we find somebody with a chronic symptom or illness, there's an indication that there's a blockage in that ability to heal, right? And so that's what's so cool about identifying where is this blockage, let's remove it so that these pathways can function normally. Our bodies know how to detox. And if they can't do it, then we have to give it some help.
So I kind of wanted to give a little case that I saw today. It was if you don't mind,
Yes,
Laura,
please.
it was a sweet young lady, but maybe in her early 30s, who I originally had seen about a year ago because she was having fertility problems, and she just found out about us. She lived upstate New York, and came in because she wanted to get a nutritional assessment because she was having fertility issues. And when we did her blood test, we found that she had quite a number of nutritional deficiencies, including low iodine, low iron, low B vitamins, and low amino acids. So not enough protein in the diet. She didn't have any mercury and lead like we usually check people for. We didn't find any of the typical like infections or viruses. So there was no like Lyme or things like that. And all I did for her was put her on the anti-inflammatory diet, which simply was avoiding dairy, wheat, and sugar. I started her on some nutritional supplements like iron, fish oil, iodine, and also uh, we started her on nutritional IVs. And thank goodness, within about 3 months, she was pregnant,
Cool.
and her energy was great. So I just saw her. She's 36 weeks pregnant right now,
Oh, wow.
and she said, "Now what do I do when I'm about ready to deliver?" And I said, "You came to me at the perfect time because uh, like her energy is great." She said that she had the easiest pregnancy she could possibly have ever imagined. She never had nausea. Her appetite's been great. She's no headaches, no fluid retention. It's like every woman would wish for this, and this woman was really struggling a year ago. But what we wanted to prepare for is postpartum. because after delivery, and she's obviously hoping, she's not obviously, but she's hoping to breastfeed. And I wanted to make sure that she was prepared nutritionally, because the child during the breastfeeding time is really going to be taking a lot of nutrients from the mother. And a lot of mothers are not necessarily thinking about staying on their prenatal vitamin, their iron. So we did blood tests to get an update. Her ferritin was like at 5, so she's iron deficient. We started her back on her iron supplement. We did a fatty acid test, and her fish oil levels were really low. So we started her back on fish oil. Her iodine was high for a bit. Now it's low again. So we restarted her on iodine. And the point is even though she was feeling great, if she had delivered and then started breastfeeding right away without the proper nutrient support, my concern is that she would get really tired quickly, and it would have a negative impact on like postpartum, potentially postpartum depression.
That's right. Her mental status would be directly impacted by that. Yeah, that's so cool. And I think it's really valid here to note that, even though she was asymptomatic, there were still deficiencies that you were able to check for. And this is really like preventive medicine here, right? Let's not wait until, she is having postpartum anxiety or depression or a mood disorder, but we can be on top of that and helping her heal from the birth and recover from the pregnancy. Even pregnancy, right? The baby takes a lot of nutrients from the mom, and so it's about replenishing and having a quicker recovery after the birth.
I'm not sure if you've ever recommended to patients, and I think this woman's not going to be able to do it, but sometimes we've had patients that have done, it's going to sound a little bit crazy, but something called freeze dried placenta
Yeah, I
capsules.
did that myself actually. So it's
Okay.
not that crazy.
It, it's normal.
It's normal. Yes, I my son's 2 years old now, and I did have my placenta encapsulated, and it was very. It's full of nutrients, right? And so that was helpful for me that first month after delivering, just in that recovery process postpartum.
Well, it's full of nutrients, but even more importantly, it's full of HCCG, which is human chorionic gonadotropin, which is the main hormone of pregnancy. And the magic of HCG is that it helps to work as a master hormone to ensure that a person's still able to produce proper stress hormones, thyroid hormones, and sex hormones. And that's why amazingly, taking it orally still allows for that HCG to do its work
Hmm.
properly.
That's really cool. I didn't even know that component about it. I knew it was helpful for mood balance and healing and energy, but now I know even more.
Yeah, and in particular, that's what my concern is a lot about for a lot of women that are having postpartum depression, is that they're having like major hormone drops, including low progesterone. And that's where HCG, or excuse me, the freeze dried placenta, I think, is really not getting its full fair share of use, because a lot of gynecologists just haven't heard about it. But some are progressive, and they are open to letting their patients try it. And like you, the women that we've worked with have all said that they felt great until they stopped taking it.
I know. I did feel really energy wise, mood wise. I felt really good, and this is as a brand new mom with a newborn. So obviously there was sleep deprivation, but I still felt great. And I want to ask you this question. I stopped it actually only because I was having low milk production, and a lactation consultant told me it was linked to the placenta, that there was hormonal, like with the LH, no LH. With prolactin. Yeah. Have you heard of
Ah,
that?
I, I, I think that may be a little bit of hogwash. I hate to
Yeah.
say it. Uh,
I have to say I stopped taking it and my milk supply didn't change. So it wasn't the miracle I was looking for.
no, I mean, usually, I have to give my wife credit. She followed. So this is, I also, it one of the things in the United States that we've lost a little bit of is some of the traditional cultural practices that families and generations had practiced for like hundreds of years before we became modern. But those practices really allowed for women to have a much more successful postpartum recovery process, and also have allowed for like great milk supply and great recovery and helping to prevent the hormone fluctuations. So my wife is Asian background, and she like was preparing uh, her bone broths for like a week before delivery. So she had these pre-packaged frozen chicken broth soups that she brought with her to that she basically had me bring to the hospital. That was about the most useful I could possibly be, and she had like the most amazing recovery both after her C-section, which was first, and then she had a VBAC, a vaginal birth after a C-section for this our number two, and both times I couldn't believe how fast she recovered, and both times she had like the crazy milk supply, crazy.
The
And
bone broth is so healing.
so the bone broth and lots of ginger tea
Oh, wow.
or and ginger soup, and she also did ginger with black sesame oil. It was like because it's very warming and it improves circulation and that's really what it's all about when it comes to milk production. You just need to have lot of fluids and a very good circulation.
Yes. Oh, that's very
And
cool. Thank you for sharing that.
well, it's my wife. She's taught me a lot. That's thank goodness. But so, anyways, I don't mean to get too far off track on our toxins and keep it, having healthy pregnancies. But it's all part of making sure that women are well supported, uh, both pre, during, and postpartum, because each set stage is very important in its own right. And sometimes we forget about each stage, uh, just because we're too busy thinking about our other things.
Right. And I think that is true. I think the average person thinks like, okay, once I'm pregnant, I'm going to stop drinking alcohol and, cut back on coffee or cut it out. And there's definitely an awareness about eating better. But really, this ideally starts prior to the conception. And in my office, I recommend 6 months prior to conception, and then also the postpartum period. What we're putting in our body, as moms that are breastfeeding, gets into the breast milk, and we want to minimize that toxic load for the newborn.
Yeah, it's very true. And by the way, that also goes to speak for the. I keep on going back to the stress response. I am not under that much stress, Lori, so you don't have to worry about me.
Good.
I've been trying to manage it. But I know we talked about it enough for you to be like, is Morrison under some stress
I
here?
mean, you
He's
have a very
an
busy
expert.
practice and a family. You've got a lot going on.
So, I mean, I have started meditation, and I'll tell you about it later. But I do want to say that the stress hormones also get into the breast milk. So if and also is circulating around the body when a woman's pregnant, so they can affect the babies as well. Now, obviously, a woman is going to be living in the environment that they're living in, so not everybody can be in control. But at least one must be mindful of the reality that a mindset does affect hormones that then will have an impact on babies, and then that will affect their epigenetics, their genetics, which then has an impact on how the babies are going to thrive in the society. And the most the one of the most common referenced examples of this is what happened during the Irish potato famine, when there was a lot of stress because of famine, and a lot of the Irish came to the United States in the early 1900s. And what was found was that the women that stayed in Ireland during this potato famine had children that were basically malnourished, but they had very difficult time thriving, and had much higher rates of infection, and did not do so well. So it's not just about the calories; it was also about the mindset and the emotional stress that everybody was under.
Yeah.
So
I actually, sorry to interrupt you. I heard a really interesting research article about so moms that are under really high stress levels during their pregnancy are in this fight or flight state, and the babies in utero will actually have hypertrophied adrenal glands to help produce additional adrenal hormones for their mother. And they're born in that state, right? They're born fight or flight. And you're going to see, like, how is a child going to behave if they're born into this fight or flight state? They're going to be more anxious and
Irritable.
yes, and ADHD and all these other, labels that get put on these children, and they want to be drugged. They want, it's like, this is really can actually begin in utero.
Yep. And so now obviously this is, we just try to do the best that we can do. And the more that a person is going into the pregnancy process with some awareness, the better a person is going to be able to try to do things. Like, I remember when I was growing up, they had like these campaigns for playing Mozart to the baby in utero to see if it would have any impact on brain development. I wonder whether it was the Mozart music that was affecting the baby's brains, or it was the Mozart's music that was affecting the mother's, calming the mother's stress hormones. So one can postulate, but nonetheless, it certainly is not a bad thing to be listening to Mozart when you're pregnant.
Yeah, for sure. And I know you had started to touch on epigenetics. Do you want to talk a little bit about what is epigenetics and how that impacts our detox pathways?
Great field that's just like now starting to really spread its wings.
I love epigenetics, by the way.
Uh, it is a great kind. It's so basically what's going on is right now everybody is looking to try to get better understanding of how our genes affect uh, who we are as individuals. So there's a lot of genetic testing that's been done. The genetic testing has some limitations because the genetics is basically just the blueprint. It's kind of like our roadmap. It tells us what roads we have, what the potentials are, and but their limitation is it doesn't tell us how our genes are going to be turned on or turned off in a living environment, like with stresses. So we know that two people with very similar genes are not necessarily going to respond to their lives the same way. And the examples I often get is we used to do a lot of 23andMe for genes for detoxification. And those genes we found very often in patients that were very healthy, they seemed to have genes that would suggest that they'd be terrible detoxifiers and that they would be having histamine reactions. But they were feeling totally good and they were living their happy lives. While we had patients that were having terrible chemical sensitivities and terrible rashes and histamine issues had really good detoxification genes. And the difference is the gene is only related to how it's being affected by a person's current environment. And the environment is partly the one that we're living in and the one that we're experiencing. So it's our perspective. So some people unfortunately get live or grow up in a environment that is really stressful, and then their perspective on the world is really stressful. Or some people grow up in a home environment that can be really calm and nourishing, and then their perspective on the world can be very calm and nourishing. And so that's how the genes are affected by our experiences and then play out as part of the symphony that actually is being turned on or turned off within our life. And unfortunately, there's actually not an epigenetic test. There's only genetic tests right now. At some point, there will be epigenetic tests, and that will be very interesting. But I think that our ancestors had the answers thousands of years ago, and have committed all of their excellent knowledge to great works like in Ayurvedic medicine and traditional Chinese medicine, where they understand that a person should eat a certain way based on their body type or their biochemical individuality or whatever
That
their,
is
you know,
epigenetics.
exactly,
It's so, I have
exactly.
never thought about it that way, but it's so true.
So it still goes back to the basics, and it's funny how we are constantly relearning for ourselves. Like of course, we have like modern techniques, but some of the same principles still withstand the tests of time. So anyway, Lori, you know more than anybody on this, so it's I just think that that's kind of the big picture on epigenetics.
Yeah, I mean, Dr. Bruce Lipton is the father of epigenetics, and I just admire him so much and what he is, shared with the medical world about this empowerment to the people, right? Like we are not the destiny of our familial illnesses. Like, okay, everyone else in the family had heart disease. That does not mean that you have to have heart disease, right? And I think once people recognize that we have choice, we can decide what we put in our mouth and how we move our body and what type of thoughts we think, then there's an opportunity to really have a different story, maybe than even what's in our family.
Exactly. And I love Bruce Lipton too, by the way. He's really changed the way I thought about the world.
Yeah,
He, you know, it's his, his, his way of explaining in kind of a little bit more of a scientific way about like the powers of the natural world through positive thinking and, sort of getting what we're thinking. It's remarkable how he's been able to show people that they can change their lives by changing the way they think.
that's right. It's really can be sometimes that simple. And, um, I think it's really important for people to hear that, especially the listeners right now might be feeling a little hopeless about wanting to have a healthy baby. And there's just so much that we can do, especially in the United States where we have access to resources, right? That not everybody in other parts of the world have available to them. So I think that's really, hope is what I'm hoping to share through this podcast.
I feel the hope.
Good.
I have hope from listening to this.
Good, good. So I was checking out in your book where you speak about with epigenetics how that actually can impact detox. So meaning some people are better detoxifiers than others, right? And you mentioned that with the gene testing. So what does that
Well,
exactly mean?
the good news about this modern medicine is that we've identified like we've basically unraveled our whole all of our genetics. We understand much better like how to interpret the genetics through genetic testing, and there's a number of good genetic tests out there. Obviously, everybody knows about 23andMe, and then once a person does those genetic tests, what we've done in the past is then uploaded it into one of the uh, genomic calculators or interpreters. So it will help to filter out which are the most important genes for the detoxification process. And specifically, what that's really referring to is like uh, the MTHFR gene, which is the methylation gene, the COMT, which is the gene that helps with uh, detoxifying certain neurotransmitters. Uh, there's genes for glutathione production, which is the main antioxidant of the cells, and so forth. But the point is that doing a detoxigenomic panel, which is kind of looking at phase two detoxification potential, and then there's also phase one detoxification enzyme tests as well, which can give us a clue about how well people will manage certain prescription medicines or not. A person can take that information and then try to come up with like a more individualized program. Admittedly, I am in the process personally in my practice of looking for a new genetic company because I've not been entirely happy with how the genetics that we are getting the information on and how it's being reported for the individualization of a treatment plan for a patient. I think that it's that see the epigenetics is the missing link, and it gets a little bit frustrating because when we if we rely on the genetics, it can give us clues, but it's still has unanswered questions. So I still go back to like the basics, and if a person really wants to see, we can go through it. But like, you know, a lot of like 75% of the population have MTHFR genes, and you know,
Wow. I was going to actually say I thought it was 50%, but you actually, it's
well,
even
remember
higher.
there's this C677T and the A1298C.
Right.
So the,
If you include all of them. Wow, that's amazing. It's like
it's
the
like almost
majority.
everybody has some kind of genetics
Right.
SNP, single nucleotide polymorphism.
Right.
So, but we're all good. So I just don't want people to get like upset about it because it doesn't matter that much.
Right. Right. Right.
So the person that we
Yeah.
haven't spoken about in this process is the guys. We
Okay, let's
should,
talk
because
about
the
men.
men are still part of the childbearing process. A lot of times we forget about that
Yes.
as we get older. I mean, I guess when we're younger we don't forget about it, but sometimes we forget about it. So, men, you know, when if a couple is looking to have a child and they have a very successful pregnancy and all goes well, wonderful. But when things are not all going well and a woman is going through their process of trying to figure out what's going on with fertility, a guy also needs to go through his process as well. And for guys, it usually starts with a semen analysis. It's where there's labs that actually evaluate the semen to see how healthy the sperm is, whether there's enough sperm, whether they're the right shape and size, whether they are well formed and strong or kind of wimpy. And there's like a strict way of analyzing this. And through this information, it can give a great deal of clues as to making sure that the fertilizer is as healthy as the the soil, so that we can get a healthy egg, little seed implanted. So guys need to be aware that as we get older, our sperm count does go down. There is a limitation to that. And certainly as we get older, we get and I'm not sure if it has more as much to do with the aging process or the toxification process, because we know that certain toxins will decrease sperm supply, especially the uh, the basically the endocrine disruptors, the plastics, preservatives, and pesticides. So guys do need to be also aware of trying to limit those estrogen stimulating chemicals from their diet, and then also making sure that their nutritional uh, levels are sufficient. So getting like similar blood tests as what we would do for women, including amino acid levels, because amino acids like carnitine are really important for making those sperm swim harder, and CoQ10 levels, because that's also important for speedy sperm, and then obviously making sure that there's nothing inflammatory, because if there's too much inflammation from certain foods like wheat, sugar, dairy, which causes inflammation all over the body, including in the testicles, it can impact how well we make sperm and how healthy they are to be able to go out and do their job. So I hope nobody's cringing at this part of the conversation, but
Well, what I cringe about is when I hear that they've actually lowered the normal sperm count due to environmental toxins that have, in general, lowered the sperm in men.
yeah, along with our average body temperature, apparently has now been lowered as well. I'm sure you heard about that one.
Oh, that, yeah. I mean, as an environmental medicine doc, like, Isn't that disturbing?
Well, we also recognize that a lot of the blood values that we are looking at right now, the averages, the optimal levels. By the way, just so everybody knows, when we're looking at blood tests, the average is based on the population of people within the lab. And then every 6 to 12 months, those averages are changed or modified based on what's normal within that population.
Uh,
So
People that are sick getting blood work.
exactly. So what we have is like as our population gets less and less healthy, those blood tests, the optimal levels, the normal levels actually shift. So people are losing sight of what the optimal levels are supposed to be.
Mm. Wow, that's crazy.
Crazy. So that's why you got to work with somebody like Laura or a functional medicine specialist to make sure that you're getting assessed for the optimal levels.
Optimal health, right? That's what we're interested in. We're not interested in being part of the mainstream sickness.
Yeah, nobody's mainstreamer out here.
Oh no. So, Jeff, do you have any last thoughts that you want to share with the audience?
Well, I think you're amazing. That's I
Oh,
just
thank you.
don't tell you enough. So thank you for inviting me on, and it's a great topic. Honestly, if we help people to become more fertile, that means we're helping people to become healthier. So that let's just try to everybody become more fertile so we can have a healthier population.
Yes, and healthy babies, right? That's
That's the best
the
outcome.
next
The best
generation.
outcome.
Totally. Well, Jeff, I really appreciate you taking time out of your busy practice to join me and share your wisdom and knowledge about all things detox. And I enjoyed connecting with
I
you.
loved it, and I hope we can do it again soon, and hope to see you in person soon too.
Totally. Thank you.